So for those of you guys who are new to our Go Lives, I'm Tamanna, and I'm one of the contributors of Podman Adventures. So this is our second to last Go Live session of our long series about externships. We had Go Lives about how to write a CV. We had Go Lives about what are the tips and tricks of interviewing. We talked about how to choose an externship. So there are a bunch of things that we covered in this externship series. So if you guys want to check those out, we have all those videos uploaded on YouTube. I know those have been really helpful for me. So if you guys want to check it out, and also let us know if there's anything else that you guys want us to work on, and you guys can DM us as well. Let's see. All right. So today's Go Live session is going to be about what are the do's and don'ts when you go to clerkship/externships. A lot of us are very new to the clinic, so we don't really quite understand the different etiquettes and what would help us succeed. So today's topic is just about that. And our guest today is Dr. Kirakosian. He is the residency director at VASF for the Podiatric surgery program. So who else would we listen to other than him? So he's going to tell us all those tricks and tell us what the do's are, what the don'ts are, and what you can do to impress your residency program. So without further ado, let me go ahead and invite him. Hi, everyone. Hello.
Hi, everyone.
How's it going?
Good. How's everything else with you guys?
Good. We're very excited to have you, everyone. This is Dr. Kirakosian. As I said, he is very awesome, and he has been so nice to have joined us today and tell us the inside scoop about what the do's and don'ts of attending on clerkship. So, Dr. Kirakosian, what are some things that you think would really impress you as somebody who's clerking at your residency program?
So, first of all, I just wanted to acknowledge you guys, Podman Adventures. You guys have been doing an awesome job. And this past year or so, I've been following you guys, and we've been going back and forth posting things, and you guys have been an extraordinary job.
We really
with all this stuff.
appreciate that. Thank you.
Absolutely. So, a lot of times we get students clerking at our facility at our hospital, and the earliest that they come is let's say a third year. From some of the schools that we can have a third year, sometimes let's say Chicago, the Scholl College sends their late third years to us, and as early as fourth years when they're starting out initially, transitioning from third year to fourth year. So it's a big transition. A lot of times, students, what we do with our students is I always get them in touch with our residents. Whenever we have, let's say, 4 students coming clerking to our facility, about the Friday of or the Thursday of, we send an email out to the students and welcoming them and telling them this is our academic schedule and this is what the expectations are, and make sure they're ready for it. So everybody gets an email and a welcoming email, and when should they should arrive, what time they should arrive, what should they be wearing. Let's say some people wear, most of the time we require scrubs with a white coat. Name tag, obviously, and the badge. The badge at the VA, they always get it there. They get their badge, I think either the day of or maybe a day before that. So outfit-wise, they don't have to be dressed up. You can come in casual, you can come in scrubs. And the reason we do that is because we have a lot of clinical interactions with patients, one-on-one. So every student gets assigned to a room in our clinic, and they get to see the patients right away. Presentation is something that's very important. So what we'll look for is someone that is willing to learn, someone is willing to take criticism, because initially when they start out, they're pretty fresh. They're not going to know what's what. I highly recommend students to look up how to present a patient. Starting from the HPI, what they come in for, a chief complaint and HPI. Just go in a chronological order. Don't go back and forth. That's the number one thing we tell our students, and they're going to make a mistake. It's okay. Initially they're always going to make that mistake, but once we look for a progression, from day 1 to day 30th or the day 31st that they're there, that's kind of what we're looking for. We're looking for a nice progression from day 1 to the last day, even in. We also want students to be more, we don't want them to wait until they ask a question or we ask a question. We want them to be, come up with something, be more proactive, ask the residents, how can I help you? How can I help be of assistance, or maybe rounding on the weekends with them? Because we do have patients that we round on the weekends and the residents go in Saturdays or Sundays to round. So those are the initial things that can be done. As far as like what things to bring with you guys, as far as a clerkship goes, a lot of students bring their whole bag. Most of the time you're not going to need any of the bag, not even the stethoscope unless you're on medicine service. Into podiatry, sometimes if you have a Doppler comes in handy. If you have, let's say, a protractor sometimes comes in handy as well. Obviously, people bring their phones, right? Sometimes they ask, can we use the phones in a clinic setting? It's okay to use the phone, but not while you're interacting with a patient or interacting with an attending or interacting with a resident. It's okay if you on a lunch break or whatever it is, you can still read books, and you can always do that.
So what's your opinion if you asked a student something and they wanted to quickly look it up on the phone, say they didn't know the answer, but later on they're looking up the phone? Would you recommend to not do that at all, just to be on the safe side? Or is it something that's okay if the student is always proactive and trying to learn?
It's that's an excellent question, because a lot of students, they get, let's say, if we ask them a question, they don't know any of the answer to that question. We usually tell them, look up and let us know the next day, and that's totally fine. But if somebody, let's say, the next day comes in and we ask them, okay, have you had a chance to look it up, and they didn't look it up, that's a big problem. But right there in clinic, you don't have to. We're not going to make you feel obligated, unless for a break time, you have a break time. You go look it up and you say, you know what, I did look it up, this is what it is, and I have an answer for you. Great. But not, let's say, immediately while we're doing patient interaction or we're busy. That's not a good idea to do that. So we're not going to hold you accountable if you're not going to let us know the next day. It's totally fine.
Yeah. So if, say that the student had learned that topic, but the student wasn't asked the next day, do you still recommend that the student makes an effort to tell the physician that, like, hey, you asked me to look this up and I did. Do you want to know about it? How should they approach it?
Yeah, that's exactly. And sometimes, we get so busy, we forget about what we asked the day before. That's exactly what you want to do. That's exactly, that's actually a big thing, that, you didn't forget about it. You were proactive, and you find that downtime, let's say in between a patient or something, that you have some time, and approach that attending or whoever it is, the resident maybe, and ask them, this is what I found, this is what the answer is. And it's a very impressive thing when they will never forget that.
Yeah, I think so. I think like these are the things that we all get a little confused about, like, because we get so scared when we're at the program or clinic. I mean, like, we've been to like few places, but we're just like so nervous, so we don't really know how to approach it. So
don't be afraid. It's something that, if you're the one thing that a lot of places don't like is somebody being very cocky and they're over themselves. That's one thing that's very noticeable. You're there to learn. Even if you know the answer to that, you always need to say, what, is there anything more that I can get out of that? So, the more tools you have in your toolbox, the better physician and podiatric doctor you're going to be. And as a person too, that goes through the daily life. Learning is just another process.
So speaking of tools, when somebody is attending clerkships, what kind of tools, aka like resources, do you think they should have in their pockets? Like, we learn about pocket podiatry and certain other books. What would you recommend that students have?
So now a lot of the stuff is pretty much a lot of the students keep it in their phones, right? They do
Yeah.
have the Glamoury, number
Yeah.
one. The Pocket Podiatry comes in a PDF file, so they upload all that stuff into their phones.
Mhm.
There are some of the stuff that some students don't have. Let's say if they're not tech savvy, they don't have a capability of downloading onto their phone or iPads. They have it by their side. So Pocket Podiatry is an excellent resource. The PI manual is another excellent resource. I use that myself, the PI manual,
Okay.
when I was studying for boards, when I was going to clinical rotations. If you want to refresh your anatomy, that's another thing that at least I'm really huge on anatomy, especially when I teach anatomy. I expect them to know anatomy.
Mhm.
You need to know the basics. So maybe something anatomy-wise, the foot and ankle. The iPhone has an app that's called an LEA. And you can download that app and you can look up a lower extremity anatomy that way too. So those three things I think is very useful. As far as like any other tools to bring into clinic, we provide most of this stuff. So maybe a Doppler is something that's really good to bring. Scissors is a really excellent thing to bring. You always have to have scissors. A small flashlight, if you can have a hold on a small flashlight. So let's say if you're going on doing rounds, everybody's scrambling to find to see the wounds, right?
Mhm.
And the student comes out with a flashlight. Okay, here you go, doctor, whatever. I have that for you. That's pretty impressive. They'll be like, okay, this guy's ready or this girl's ready for things. I use the back of my phone. I use the flashlight on the back of my phone. But some some people can bring those little flashlights and they can use that as well too.
Yeah. No, I think like that's the main thing that you want all the students to be always ready and always proactive
Hmm.
whenever they're with you at the clinic.
Yeah,
That totally makes sense.
absolutely.
So when somebody comes in first, the first day, um,
Hmm.
how early do you expect them to get there?
So usually at our facility or any other facility you go to work at, like as far as the students go, we expect the students to come in round with the residents. If you're there, especially if you're assigned to a patient,
Mhm.
you most likely will need to come and do a pre-round and go and see the patient. Maybe if you're asked by the resident, let's say, okay, go do your pre-rounds, get the lab values. Then when the attendings come, we're going to go into a round. That's a good idea to have everything ready for it. So when you're rounding, you're presenting your patient, you have everything there. You've maybe talked to the patient, you've asked them how do they feel, and all the information you'll be able to have. If it's your first day, I usually tell the residents to get in touch with them, and they come in. Let's say if we have clinic at 8 o'clock or 8:30, we do rounds about 7:30. So 7 o'clock is a good time frame for them to show up, unless they want them to come a little later.
Okay, so get there at least half an hour early.
Yeah, get there about 30 to 45 minutes earlier, and that way you're prepared for your day to go.
Okay. So what are the don'ts, would you say, that you see that you want to advise students against?
Yeah,
Big
that's
one.
there's a big list, but I would say a couple of them that is very very important is uh, don't get into a confrontation with an attending. Obviously, it's they can ask you a question that you may not know, but sometimes if you, let's say, know something and there's newer things that are out there, you're always going to be looking forward to go beyond that. So don't get into that confrontation. That's the first thing. Always be ready to, let's say, if you don't know the answer to something, say, I don't know, I'll look it up. I'll tell you. Don't start making things up. So, because we know when we've been around the block for a while, we know if this thing existed or this does not exist. You can't say there's a specific, like, for example, I'll give you an example. We're scrubbed in the OR,
Mhm.
and one of the students said that we asked them what kind of a suture this is, and it was an absorbable suture, and we said, do you have to remove this? And they started going off of a tangent, and it's just, if you're not aware of it or you don't know things, just say, you know what, I have no idea. It's something that we can teach you as well too. So don't make things up. It's something that's that's very very easily easily seen.
So
Yeah,
sometimes I feel like when students like don't know the answer that they should know,
hmm
um, what what happens? Like, how do you perceive that? Is that something that's a no-no for sure, or is that something that happens all the time because of the stress of the situation? And how should they
yeah.
handle that?
A lot of times when you're going to each institution, look at what that institution is is good at. Let's say some places are higher in trauma, so make sure you cover that basis. If you go to another hospital, maybe they're increased in limb salvage. Look up limb salvage stuff like the Wi-Fi classification. Always have the basis of where you're going. Look up to see what they're good at, what their strengths are. And then that way you can ask them the questions and you can be prepared for it too. By the way, that's another thing. Carry the Wi-Fi classification. There's a small flashcard. Always have that by you, and that comes in handy as well too. Um, but don't make things up. If you don't know, you don't know. Just tell them I don't know, and I'm here to learn, and I'm more than happy to look it up and to give you an answer the next day.
So would you recommend that before going to the clerkships that the clerk or the student get in touch with the residents there? How, and if you expect them to do that, how early do you expect them to do that?
If it's the first day, let's say tomorrow is Monday and we're having 4 new students,
Mhm.
it's a good idea to send an email a week before. If you have maybe certain things you need to do, like getting your PIV card, for example, at the VA done, or your badge done, at least it's something you can find out how to do it. Um, if somebody comes that morning up, and a lot of times we have clinic, if you don't have your badges and you're not registered, you're not going to be able to see the patients. It's as simple as that. So I'd say get in touch a week prior. That's a good time frame, and they'll tell you if you need certain things accomplished by then.
Okay.
And they usually give you an academic calendar too. We have our academic calendar set up every month, and every month is different. And that way they can get prepared for it.
So if somebody has some kind of emergency or
hmm
something that they have planned way before,
Yeah.
what do you think the protocol is for handling something like that?
The protocol is usually, 24 to 48 hours prior. If you
Mhm.
know you have a doctor's appointment, obviously 3 weeks, a month ahead, just let them know. You have an appointment, email the student clerkship director and also the director of the program, and also CC the resident. So at least all of them are aware of it. You know what? I have an appointment this day, this time. Can I be excused from clinic? And most of the time, 99.9% of the time, it should be fine. But if you have something, an emergency that's unexpected, and something came up the next, let's say, the day of, then we totally understand that's not an issue. We usually excuse people from clinic.
So how bad is it if somebody misses the clerkship altogether, um,
hmm
and they still wanted to interview with the program? How do you guys handle that? Or
Yeah, that's an excellent question. It's we at our program especially, we ask for them to come do an externship. The reason we ask that is because we want them to see what the facility is about. Do you like working there? Do you like to interact with the attendings? Do you want to be here? If they can't not make it and they're missing it for an emergency, or they can't fit it into their schedule,
Mhm.
call the director or email the director and tell them to set up a visit, maybe for like a day visit or a 2-day visit. We've had multiple students this year, even, and last year, that they've contacted us and they said, "Oh, can we come do a day or two visit?" We said, "Sure, just as long as we see you." We have if you get into it, we'll remember you. I'll give you an example. I had a student who come in from Temple, I believe. She didn't do any of our clerkship. She didn't sign up to be any of the clerkship, but she said, can I come and visit on 2 days? We said, fine, come Wednesday and then come on a Friday. She came in, and the way she interacted with everybody, it felt like she was there for a whole month. That's kind of the thing that is cool.
Yeah.
Somebody could be there for a whole month, but somebody could be here for all day, 2 days, and they make a huge kind of an impact on it too. So be part of the team, interact with it. Even though you're only there for like a day or two, ask them, how can I help you? Can I see patients? Can I do this? Can I help you with that? That's a big plus.
That makes sense. So it's like
Yeah.
it doesn't have to be a month-long externship, but if anyone's interested, they should be emailing you and like scheduling something, and that way both of you guys can interact with each other and form a team player and go from there. That makes sense.
Absolutely. Yeah, absolutely.
So
That's a big plus.
so how is that so how is working in a VA hospital different than like other residency programs?
Um, so VA hospital is I'll give an example of RVA, and then we can compare it to different regions of it too. So RVA hospital is affiliated with UCSF. We do have all the medicine residents, all the vascular or the orthopedic, any of the residencies that residents come to the VA, they're all UCSF based. So that's one of the differences. They are our residents, what they do is they rotate with UCSF residents. They're part of the medicine team. They're part of a vascular team. They're part of the dermatology team. It's the population is obviously, let's say, elderly population, primarily male population, or used to be. But now we're seeing a lot youngers, and the youngers that we're seeing is somewhere between 24, 25, 30s. People want to come in and they've been out from their service and they want to have, their foot locked or looked at, or trauma, even trauma. Some we've been getting a lot of trauma recently, like metatarsal fracture traumas at RVA. And the population is kind of higher, but it's kind of balancing it. It depends on what we need to do. We do have a lot of limb salvage at the hospital because of the type of patients we have, the diabetic patients with peripheral vascular disease. We are very, very super close with our vascular team. We do have a vascular podiatry clinic in conjunction. It's called our PAVE clinic on Wednesdays. And it's referred to as podiatry and vascular services connecting together. So that's a big plus. RVA is unique because we have outside rotations. Our residents go to UCSF rotation with limb salvage. They go to San Francisco General. They do a rotation there. They also go to a private orthopedic clinic and podiatry clinic in Fremont Surgery Center. And now we just added another rotation by Dr. Tom Chang in Santa Rosa or Hillsburg. They go do surgeries with them over there. And another addition is in Sacramento that we've added. It's a Dignity Health Northern Orthopedic with Dr. Fong Lei. I'm sure you guys probably have heard of him as well too. So that's another addition we've started, and our residents are going to start going and doing rotations with him primarily there. So it's a well-balanced place. Other VAs can be different, I'm not gonna say we put a lot of frames, a lot of this, a lot of that. No, that's not our priority. Our priority is to teach the students and residents the bread and butter, whatever you're gonna be concentrating on: trauma, limb salvage, hammer toes, bunions, everything else. And podiatric medicine, biomechanics. I think if you know all that stuff, you'll be in a better environment.
So I feel like these are like important aspects of podiatric medicine that you guys are focusing on. So for a student that's coming in new, do you expect them to already kind of know what kind of specialty they want to go into, or what they want to, I guess, like specialize in?
Well, as podiatric doctors, you need to know pretty much what we do, right? As small as an ingrown toenail, and as big as, let's say, doing recons, right? So those are the certain things. And as far as like what you want to specialize in, some people want to specialize in limb salvage. Some people want to do both limb salvage and elective cases. So I wouldn't recommend, let's say, tying yourself into one thing. The more you can do, the better you're going to be. Because when the patient comes to you, if you tell them I'm specialized in this, they're going to be confused. They're like, okay, you're a podiatric doctor, you're a foot and ankle doctor, but you don't do that. Right. So that's the question a lot of patients ask. And that's the thing, that if you're well trained, you should be able to do, I would say, 95% of the things, out there.
So is it okay for students to not know what they really like yet when you then come to
Absolutely.
them? Okay.
Yeah. Yeah. Some students would know. They're like,
Yeah.
oh, I want to be a big trauma surgeon. Great. That's great. But, you got to see what program offers that. And, we, at our institution, we also have a pediatric rotation. We have UCSF pediatrics that our residents go and do 2 months there, 1 month in their second year, 1 month in their third year. So it's a lot of times when the students come, let's say clerkship wise, to our institution, they don't see what our residents go through on the outside. And that's the thing that we try to educate a lot of the externs, that, what, this is the outside rotations that we also have. Not just because you're seeing patients in our clinic, this is not what you're going to be doing as a resident. You're going to be running the floor, and you're going to be doing internal kind of things. Then you can go out. And we usually, before COVID started, we sent our residents or students to our outside rotation, like Fremont Surgery Center. We sent them a day to spend over there to see what that's all about.
That's really awesome. So you get to see like different aspects of everything, at least in the Bay Area and even Sacramento.
Yeah. And we even have private office, opportunities. I practice in 2 private office locations, and we're going to have our residents come and kind of do the surgical cases and do private office as well too, which they already do at Fremont. Gives them a more outside rotation as well too.
So is COVID affecting any of this, and how much is it affecting it?
It did have an effect initially. Let's say when we started this in March, all the hospitals closed everything down. So they did not allow anybody to do any elective cases. And goes with everybody, not only our institution, it was nationwide. It did affect initially. We didn't have students there for a good 3-4 months. We just started having the students there, I believe, in July. So July was the first month that we had students come in. And the way we started doing it is we had 4 students, and we had 2 students come in the morning and 2 students come in the afternoon. So they would flip-flop. And that's how we did it through the days. And let's say the following day, they would switch. Now that it's a little more comfortable, we have our numbers down, the hospital is a little more open, all the students are there at all times.
Okay.
The elective cases have definitely been down these past 3 months, but we just started doing our case. I did my first elective case in the VA in July, and we had another case on Friday. So we're starting to schedule, and they're pretty much letting us do it. But again, they can shut down anytime again.
Yeah.
And that's unfortunate, but we love having our students there. We love having them come and see what we're about, and we love teaching there. We do a lot of academics, journal clubs, radiology rounds. You guys, some of you have participated in our radio rounds and also on our attending lectures that we have. Every month we have attending lectures from different doctors, like Dr. Saxena, Dr. Chang, Dr. Nick Todd did one last month as well, or this month as well too.
So I think because of COVID, a lot of students feel like they're not really prepared to go to clerkships, and they might seem like they're not ready. So what kind of recommendations do you have for students like us, and I'm sorry, 4th years actually?
Yeah, so this is what I would highly recommend doing. And I think we've been doing, I did a couple of them things. The school reached out to us and they've asked us if we want to do any, let's say, Zoom, not lectures, but interviews, right? Or let's say, if you want to do a specific interview, contact the doctor, contacted the residency director. I'm more than welcome to get a one-on-one Zoom that we can set up, and we can go through an educational process of how to work up a patient. What are the basic screws that you want to use in surgery? Is this from a striker, or is this from this side? So basic things that if you want to get your knowledge in, even get in touch with the resident, get their phone numbers, get their emails, and say, is it okay if we can set up a one-on-one Zoom or a FaceTime thing that we can go through certain scenarios. We do a lot of that at the VA once the students come. We do mock interviews. That's another thing that you guys can do, especially fourth years. And I already did 2 mock interviews with, or one of them for one of your students as a fourth year.
Wow, that's awesome. Yeah, these seem
Yeah.
like very great like resources, and we're definitely going to advertise these more.
Yeah, absolutely.
Let's see. I think we have a question. How does
Sure.
an extern stand out?
How does extern stand out? Come early, be prepared. Be prepared to have answer questions if you get asked. Help out, and also don't overstep your boundary. It's sometimes hard to do that, but some of the students, they towards the mid externships, they feel very comfortable and they need to still, we've had a lot of students that shined, and we've had a lot of students that needed extra help. But towards the end of the externships, they became well-rounded as well too. Read a lot of journals. I would highly recommend looking into journal articles of basic stuff, especially limb salvage has a good ones. Bunions have them, hallux limitus, any of the stuff that we do on a daily basis. Look up journal articles. And if you can actually impress an attending by saying, you know what, this is a recent article that I came across, we may not have read it, and they can present and they can say that, can we talk about it? What do you think? All this thing is going to be back and forth conversation.
Yeah. That's really awesome. I feel like this has been like so valuable because we all want to know what the residency director wants and how we can improve ourselves, like to make ourselves stand out. But before we end this, do you have any crazy don't stories that happened in the clinic that you want to share with us?
Sure. One time, we were in the OR, and I can't remember. It was maybe 2, 3 years back or something like that. It was a fourth year student, and we asked them a question about anatomy, simple, plain anatomy. And we asked them about the nerve, and we're doing a Lapidus procedure, and we're asking them, what is the specific nerve that passes by that joint area that you want to avoid? The guy came up with a nerve that I've never heard before. So we said, okay, can you look that up and let us know if that's a specific nerve that you found? The guy was very embarrassed when he came the next day, but at least, he said, I'm sorry, I shouldn't have done that. So one thing that you shouldn't do is make things up.
Yeah.
Because you can't.
I mean, you guys are so knowledgeable. Like I feel
like... sometimes I'll tell you this, a lot of times nowadays the students, they might be very bright and they might be maybe brighter than they're attending, but don't show that. Just still hold the boundary and make sure that you understand, and that will make you a better person that way too.
Yeah, I think it's like about respect and somebody you can learn a lot from.
Exactly. Yeah, and you never want to burn your bridges. That's right. One thing. You never know.
I think we have one more question.
Sure.
I think we already covered that. I can go over that later on a separate video. What tools do you suggest an extern to have on them? This video will be recorded and we'll publish it. So if you guys want to check that out, because he gave us a really good list of all different tools you should have. Do you have anything else to add, Dr. Kirakosian? Or any last advice?
Yeah. I mean, again, we love students when they come to our program. It's or anywhere else you go to. Make sure be prepared. Make sure you know what the facility and what the institution is about. Reach out to the residents. Reach out to the residency directors or clerkship directors. make sure you're in touch with them on a constant basis. The other thing that people have been doing is they've been giving thank you notes after they finish their programs. That's a small note goes a long way. I've so far collected like a bunch of notes that I keep on my desk, and whoever comes in, I put them on my desk and I remember it. Even from 2 years back, I keep those thank you notes, and that's very, very, very effective.
Thank you so much, Dr. Kirakosian. I feel like
Yeah.
this probably has helped so many people who are wanting to know so much about attending clerkship, and you told us about so many resources to tap into as we're stuck in this COVID era. So
Yeah.
thank you again for coming on
Yeah.
here. And
hang in there. You guys just hang in there.
And you guys, he has an Instagram account as well. So if you guys want to follow, as you guys can tell, he's very, very easy to reach. So thank you again so much for coming, and thank you everyone for tuning in. You guys have a good day. Goodbye.
Thank you. Take care. Bye.